Now let's talk about the different types of blood tests that we can use. So a CBC, or a complete blood count, includes all of the different blood tests. So that includes RBC count, which is a red blood cell count, an HCT, which is a hematocrit, an HGB, which is a hemoglobin, WBC, which is a white blood cell count, and the differential, which is differential white blood cell count, identifying those 5 different types of white blood cells and what each one does, and if they're elevated, what kind of infection may be going on, as well as a platelet count. So, starting with a red blood cell count, or an RBC. This is responsible, of course, red blood cells responsible for transporting oxygen from the lungs and bringing it to our body tissues. That oxygen is carried by hemoglobin, as I've mentioned already in this lecture and in previous chapters. Red blood cells are produced in our red bone marrow, and it's a biconcave disc. So we've already seen the picture of it. It kind of looks like a disc with an indent in it. Red blood cells, we have millions die every day, but there's millions being replaced. And we measure the number of red blood cells in our blood by cubic millimeter, or millimeters cubed. Hematocrit test is to determine the amount of red blood cells that are packed in a specific volume of blood. So the normal values for men of a hematocrit are 40 to 54%, and for women are 38 to 47%. So women usually have a lower percentage of red blood cells on their hematocrit. Higher than normal hematocrit is caused by severe dehydration or shock, and a lower than predicted hematocrit can be caused by a hemolytic reaction or acute massive hemorrhaging, such as blood loss. Hemoglobin is measured in grams per deciliter. That's usually used to determine if a patient has anemia or not. The normal values for men are 13.5 to 17.5 grams per deciliter, and in women are 12 to 16 grams per deciliter. And in a newborn baby, they generally are 14 to 16 grams per deciliter. A decreased hemoglobin is caused by anemia, excessive fluid intake, which dilutes the amount in your body, hemorrhaging, and also during pregnancy. Increased hemoglobin can be caused by chronic obstructive pulmonary disease, or COPD, as well as high altitudes. A WBC, or a white blood cell count, helps white blood cells themselves are used to help us fight infection. They are part of our immune system. We have granulocytes and agranulocytes. Granulocytes possess granules in their cytoplasm. Those are the polymorphonuclear cells, including the basophils, the eosinophils, and the neutrophils. And the agranulocytes only have the mononuclear. That includes your monocytes and your lymphocytes. So the WBC white blood cell count, with either increase or decreases of the specific type of white blood cell, helps determine what kind of disease may be going on, or illness or infection. Normal values of white blood cells are 4.5 to 11 times 10 to the third cubic millimeters, and for women 4.5 to 11. So they're the same for men and women. Our white blood cells should be the same. Now, looking at the different types of white blood cells, we would need to use a differential leukocyte count. So there's the overall white blood cell count, and then there's the more specific, which would be the diff, or the differential. So those neutrophils, those are part of the granulocytes, those polynucleomorphic or morphonuclear cells, combat bacterial infection, inflammation, and are in stress. So if the neutrophils are elevated, we would think that the patient might have a bacterial infection. The lymphocytes, which are part of the monocytes, when they're elevated, it's generally a result of a viral infection. And eosinophils, as I said earlier, are part of that body's inflammatory response and respond to allergic antigens. So asthma, allergies, but also eosinophils can be elevated if there's a parasitic invasion. Monocytes, those are part of the agranulocytes, those mononuclear sites. Those respond to severe and chronic infections. And then the basophils respond to inflammation and to blood disorders. So breaking it down, the normal diff values, neutrophils are usually 60 to 70% of the white blood cells. Lymphocytes make up 20 to 40% of the white blood cells. Eosinophils make up 1 to 4% of the white blood cells. Monocytes make up 2 to 6% of the white blood cells, and basophils would make up 0.5 to 1% of the white blood cells. So each of these types of white blood cells has their special function, and by monitoring them different amounts, we see, is something going on. Also in a CBC, we would take platelet counts. This determines the number of platelets or thrombocytes in the blood. The normal value for platelets are 150,000 to 350,000 cubic millimeters, the smallest of the form elements of the blood. They are disc-shaped, oval, flattened, or round. So they have a variety of different shapes, and they help the blood clot and help maintain the vascular integrity. They kind of give a form to what's going through. Now, when it comes to clotting, we also want to know how the blood is clotting. So we have two different tests that can be used to determine the clotting, PT and PTT. So the first one is PT, and that is a prothrombin time or a pro time. So PT is a timed test to see how the blood clots. It's an indicator of the levels of the prothrombin, which is a protein that is produced in our liver that will convert to thrombin during the clotting process. A normal PT takes 10 to 14 seconds. Increase in the PT indicates the blood will not clot as quickly. So if it takes longer than 14 seconds, that's an increased PT or an increased prothrombin time. A decrease means that it's going to clot quicker, an increase in that ability to clot, which could potentially mean that a patient may have problems with blood clots. A PTT is a partial thromboplastin time, and we also use that to determine the ability for the blood to clot. It looks for a specific chemical in the body, which is known as intrinsic thromboplastin, and it's used to monitor the effectiveness of heparin and anticoagulation therapy. Conditions caused changes to PTT are similar to those that cause the changes to the PT. A normal PTT will take 30 to 45 seconds. Now, in your book, there is this table, this chart, that gives you the abnormal test results and what may be causing it. So please review that material in your textbook.